Assalamualaikum warahmatullahi wabarakatuh. My name is Amirah Raihan Binti Tajuddin 1816914, and in this video, I will share to you the topic on schizophrenia disorder. So what is schizophrenia disorder? Schizophrenia is a chronic psychiatric disorder with a heterogeneous genetic and neurobiological background that influence early brain development, and it expresses as a combination of psychotic symptoms such as hallucination, delusion, and disorganization, and motivational and cognitive dysfunction. So, actually, schizophrenia can be considered as cognitive and behavioral disorder, which it involves how the brain processes information and affect a person's behavior, where indeed, person with schizophrenia they process the information abnormally, especially patients with first episode and chronic schizophrenia, as it is a psychotic disorder, meaning the person with schizophrenia does not identify with reality at times. How can we identify a person with schizophrenia disorder? There are several symptoms such as social withdrawal, anxiety, delusions, hallucinations, paranoid feelings of persecution, loss of appetite or neglecting to eat, and loss of hygiene. Actually, those symptoms can be characterized into several types of schizophrenia. The first type of schizophrenia is paranoid schizophrenia. Paranoid schizophrenia can be distinguished by paranoid behavior, including delusion and auditory hallucination, such as feeling being watched by someone. And the second type of schizophrenia is disorganized schizophrenia. It is an exhibit behaviors that are disorganized or speech that may be bizarre or difficult to understand. It can be displayed inappropriate emotion or reaction that do not relate to situation at hand. And the third one is catatonic schizophrenia, which it may vary between extremes. They may remain immobile or may move all over the place. And the number 4 is undifferentiated schizophrenia. A person exhibits behavior which fit into 2 or more of the other types of schizophrenia, including a symptom such as delusion, hallucination, disorganized speech or behavior, or catatonic behavior, which it explains the combination of those types of schizophrenia. And the last one is residual schizophrenia. It called residual schizophrenia because if a patient has past history of schizophrenia symptoms, they may experience again the symptoms, which the person may be in complete remission or may at some point resume symptoms of schizophrenia. Next, we move to the causes of schizophrenia. The first one is genetics. It can be hereditary and it runs in the families. And the second one is environment, where is there any external factors like stress or pressure from outside, it can cause of the schizophrenia. And the third one is brain chemistry. It can cause by a chemical imbalance and other changes in the brain. And the fourth one is the history of abuse or neglect that the schizophrenia patient have experienced in the past. After we have gone through all the details on the schizophrenia part, let's move on to the case study of schizophrenia patient. I have interviewed a patient of schizophrenia disorder who named Puan Siti. She is a 50-year-old widow who has been admitted to a psychiatric ward by her children after she showed strange symptoms such as talking alone, showing reaction that does not relate to the situation, hearing voices, displaying inappropriate emotion, and acting out of her habit. Her children said that this happened after she complained that she was unable to sleep for 3 days, and the day after, she started to act weird. And according to one city's children, she was described as a secretive person and never shared any problem with them, including issues at work. However, there is one day, one city suddenly shared to her eldest daughter that she feels stressed at work as she cannot keep up with the technological changes in the workplace, especially the new accounting system in the computers. In fact, during that stress period, she needs to prepare things for her daughter's marriage, and it might add to the burden that she has as a single mother. Actually, this is not the first time she had this kind of episode throughout her life, as she has suffered it several times since her teenage years. She also have family history on mental disorder, where there was one of her uncles suffered from mental disorder but never been diagnosed to a psychiatrist before because her family did not really exposed to the knowledge of mental disorder, and they preferred to send her to Rawatan Ashifa as they believe it may be interference from subtle things like Iblis or demons. Now, Puan Siti has shown some improvement in her mental health, but she still depends on her medicines every day. However, she has some side effects from the medicines where she's unconsciously have trembling hands and feet, and sometimes she has a habit of licking the back of her teeth. Therefore, we have figured out the symptoms, the causes, and also we can identify the types of schizophrenia disorder based on the case study that I have shared with you. So I think that's all from me. Thank you.